Hi, my name is Lori Gunnels, and I am with Laterno University. I will be speaking today in regards to epigenetics and how it plays a role in children with anxiety and stress disorders. The research will present data to show a positive correlation between parent level of stress and a child's level of stress. The study will include a sample of a minimum of 100 participants, focusing on mothers between the age of 40 to 50 years old and their firstborn female child, who ranges from ages 14 to 16 years of age. The essential features of the study method will be a correlation study to measure the physical and psychological symptoms of stress between the mother and the daughter. The findings would show a positive correlation between the stress of the mother and the daughter. There will be limitations to the study, including the small sample size. The results would be more in depth with a larger sample and if it was to include more variables. Research has shown that the stress and anxiety levels of children have increased over the recent years, especially in children. The Center of Disease and Control Prevention revealed approximately 4.4 million children have been diagnosed with anxiety and depression disorders. These numbers are continually rising. Statistics suggest that despite available treatment, 40% of patients with depression and stress disorder do not seek treatment, and half are offered beneficial treatment. The overall aim of the study is to determine the correlation between the child and parent's anxiety disorder. We know that stress has an impact on the mind and the body. The paper will explore how genetics could be a factor in mental illness increasing in children. The goal of the research is to identify how this could affect future generations and explore ways to prevent or alter the curve of anxiety and stress disorders, not only in children but adults. The proposed method is research would use a combination of methodology, including observing the participants to collect data to analyze. The method would be a correlational study to investigate the associated variables between the children and mother. The participants would be observed to analyze their behaviors and mental health and stability. There would not be parameters that would specify a history of mental illness. The research would use the correlation study and observe to understand the behaviors in conjunction with the applied behaviors. The participants would be in a controlled environment as well as their normal environment due to the nature of the study. The participants would be given certain tasks, and we would observe the behaviors to the researchers so they could identify the stress, disorder, and anxiety in the participants. The research would be able to identify the trends through the analysis. The measures would capture the level of stress. The physical symptoms of stress could be fatigue, headache, muscle tension, teeth grinding, or changes in the participant's appetite. The other symptoms could include irritability, feelings of nervousness, lack of energy, or even sadness. The anticipated results would suggest a positive correlation between the levels of stress of the child and the parent. A statistical test is used to find the strength of the association between the two continuous variables. In the study, the Pearson correlation would be used to collect and analyze the mother and daughter stress levels to determine the correlation. In addition, the study would use the multiple regression test to collect and analyze the data and the outcome of the stress. The predicted results would indicate that there is a correlation between the stress levels. Children would show that they mimic the behavior of the mother's stress. The research would determine that parental bonding for those with depression is a factor in the anxiety and stress. The research analysis would suggest that the mother's behavior would pass to the daughter, resulting in generational levels of stress, as well as a positive correlation between the levels of stress. I find that the research would be a good topic given there is an increase in the depression among children and adults, especially with 2020 being a year of challenge for many people, and due to the COVID and the altered lifestyles that many of us are used to. Thank you for your time, and I am eager to see this research proposal be put into action.